welcome. I see that people are joining us from all over the globe, the UK, Portugal, India, around all over the US. Thank you so much for making the time to be with us today. My name is Tulsi Chase, and I'm the head of education and outreach at the Sadhguru Center for a Conscious Planet. And we are so delighted to welcome you all to our speaker series, where we present virtual lectures and discussions highlighting the research and explorations of our multidisciplinary community of scientists, global experts, and thought leaders. So for those of you who are joining us for the very first time, just a little bit about our center. The Sadhguru Center is a multidisciplinary research center based within the Department of Anesthesia, Critical Care, and Pain Medicine at the Beth Israel Deaconess Medical Center in Boston, USA. And our mission is really to weave together science and spiritual wisdom through research, education, and outreach. We aim to bring tools of well-being to both patients and healthcare providers and the public to enhance consciousness, cognition, and compassion. So in this vein, we offer wellness programs, we conduct scientific studies in various communities, and we really try to bring together world leaders from diverse fields to collaborate and innovate health and well-being solutions. Next, please. So today we have a very, very exciting topic on integrative health through music therapy. And joining us today to talk about this topic is Dr. Suzanne Hanser, who is the founding chair emerita and professor of music therapy at the Berklee School of Music, and is also the president of the International Association of Music and Medicine. So Dr. Hanser will be identifying music-based interventions for depression, outcomes of music therapy for pain in childbirth, and also music therapy interventions in family medicine. So really applicable to a variety of those of you who are joining us today. Dr. Hanser is founding chair emerita and professor of music therapy at Berklee College of Music, and is also the past president of the World Federation of Music Therapy and National Association for Music Therapy. Her individual National Research Service Award from NIA launched a research agenda to develop and investigate the effects of music therapy on pain, anxiety, physiological changes, indicators of stress, and quality of life. She's conducted randomized clinical trials on the impact of music therapy protocols in oncology, geriatrics, cardiac rehabilitation, and family medicine. So Dr. Hanser has established the music therapy program at the Zakim Center for Integrative Therapies at Dana-Farber Cancer Institute. She is the author of the New Music Therapist Handbook and co-author of Manage Your Stress and Pain, a book and CD with Dr. Susan Mandel. Her latest book, Integrative Health Through Music Therapy, Accompanying the Journey from Illness to Wellness, explores the use of ancient and contemporary music-based interventions in people who are suffering. She is the recipient of a SAGE Publications Prize, Model of Healing Award from the Children's Music Fund, and the American Music Therapy Association's Lifetime Achievement Award. So I know I speak for our entire team when I say we're delighted and so grateful to have you, Dr. Hanser, talking a little bit about your work with us today. So a warm welcome to you, and the stage is yours.
Thank you so much, Tulsi. It is a great honor to be here, and thank you for the lovely introduction. I actually like to introduce myself through music. And so let me share my screen first, and then I would like very much to set an intention for our gathering today as we get acquainted. And again, it's important to me that that you know me through music. And so I invite you to first look at this intention, a nice quotation that I hope you will appreciate. And then if you're interested in closing your eyes and going inward as I improvise on this Native American flute, please do so. Let the music take you to a place you'd like to be. And if you're not comfortable closing your eyes, just a gentle gaze downward might do the trick just to get you in the mood of taking in some new information and joining our community here. So just take a nice deep breath in through your nose and exhale deeply and let go of anything that might get in the way of your appreciating this music and our presentation. And with the next breath, just take in life-affirming air. Exhale. And if you're ready, listen to the sounds of the flute and let them transport you to a place you'd like to be right now. Enjoy. And take a moment to take a deep breath and savor any of the thoughts, feelings, places you may have visited in your mind's eye. Exhale anything that came up, any discomfort, any thoughts that got in the way. Just let them go with the breath. And begin to just move your fingers and your arms and maybe your feet and your legs. Get some energy back in your body as we rejoin this presentation. Open your eyes if you haven't already. And I'd love to hear from you in the chat if you had some experiences with this music. Were you able to go to a place in your imagination? Were you able to feel a sense of, well, this other dimension in the Sadhguru quotation? Did you feel that light? Did you feel a heaviness of relaxation? Did you notice changes in your body, in your mind, maybe even in your spirit? Just add them to the chat if you like. And if you just want to keep them to yourself and enjoy the experience, that's certainly fine too. So I do hope that you enjoyed that little introduction. And now I want to introduce you to the field of music therapy. Don't know how familiar you might be with the field, but indeed there is a national organization and certification board that sets standards for this profession. So in order to be a qualified music therapist, you must have attended and graduated from an approved program at an accredited school. You must complete clinical hours in a clinical practica and internship, and you must pass a board certification examination. Once you have become board certified, you then need to update your continuing education. So we often see in the literature interventions that are music-based, and they're referred to as music therapy. But unless they are conducted by a qualified practitioner, they really are not what we call music therapy. So I'd like to share with you some of my research, and I've selected some research investigations throughout the continuum of life. So I thought we'd start with childbirth, and this was one of my first studies using subjects as their own controls and training them in a music therapy protocol where they selected music that they loved, music that was meaningful music that was important to them, and music that relaxed them or kept them focused. We then practiced that music with breathing techniques. And as they were practicing at home, we had them close their eyes, and perhaps similarly to what you experienced for just a few seconds, had them essentially condition a relaxation response to this music in hopes that when they went into labor, that immediately that music coming on would bring on a relaxed response that they had practiced. And in order to use each subject as her own control in this case, there were 10 contractions using the music that they selected for this stage of labor, and 5 without music. And what I did was to observe behaviorally indications of pain. So while it's very difficult, as you can imagine, to observe relaxation, certainly during labor you can identify areas of tension, fists, shoulders raised, eyes clenched shut, teeth clenched, with shifts in the bed so that you can see they're not feeling comfortable, requesting medication. All of these behaviors were observed during the time music was on and during the time their special music was off. And as a result, we were able to compare. But first, let me just mention some of those breathing patterns. You see here a contraction just over 60 seconds, and then one over 90, just about 90 seconds, with a breathing pattern for inhaling and then short exhalations. Inhale. And you can imagine we had music which was very rhythmic and increased in tempo through labor, more of a focus of attention versus being very relaxed at the beginning. And the music was specially selected to help regulate these breathing patterns. And in the first 7 subjects that we worked with, in looking at these pain-related responses for music versus no music, every single participant improved in their, according to the observations of pain-related responses. Some, a whopping 30 or 29 responses in the course of a contraction. So this was very revealing. And indeed, the women referred to this intervention as definitely helping with their pain during contractions, that the music therapist presence, as well as the music, was helpful. And they described music as an auditory focal point, something they could focus on. Many of them had a visual focal point during labor, but this was something they could attend to and also celebrate. And here's one of the very popular music pieces for the celebration of the birth. So this was a rather successful intervention for early life. And much later, I had the pleasure of working at Boston Medical Center with a team from the family medicine unit. And these patients were mainly referred for pain management. They had some chronic conditions, some of them just unexplained pain, and we did a feasibility study to determine whether music therapy interventions, one-on-one at bedside during their hospital stay, could make a difference. And there were a number of ways in which music therapy was used, not just teaching relaxation, as you saw with the women in childbirth and labor, but also here we were interested in the experience of illness, the experience of having pain. And so the music therapist interviewed each participant in our study and asked them, how are they getting through this? What is their experience of their illness and of their pain? And she helped them to write a song to express what was going on. One gentleman who was experiencing severe lymphedema, his whole body swelled, and he was in pain, he was very uncomfortable. They couldn't find the cause of this lymphedema, and so he was hospitalized for a long time, not knowing what was wrong and what he could do. He was a guitarist, and so we found him a guitar, and he expressed his experience. I'll play a segment for you from his own original song. Ooh. Let me see the lyrics here.
My life right now is pretty much on hold. My time is spent waiting to heal. I feel stuck on an island, watching others sail by, their lives moving forward, while mine is still standing by, trying to find the music within the noise, the eye within the storm, a calm inside the tension, the peace inside the war. What used to be easy is a struggle now. Everyday tasks a real challenge. Finding the focus is often elusive. Every day getting harder to manage. Trying to find the music within the noise, the eye within the storm, a calm inside the tension, the peace inside the war. Trying to find the music within the noise, the eye within the storm, a calm inside the tension, the peace inside the war. The music within the noise.
So I hope you see this, as I did, as kind of an existential therapeutic process to really examine what it's like not knowing the diagnosis, being in pain. And these images I find so profound. The music within the noise, the eye within the storm, a calm inside the tension, the peace inside the war. Music can be such an expressive medium to really get at something beyond the words, although these words are quite meaningful. The music itself expresses so much. And interestingly, in our findings of this study, we didn't see real significant changes in pain, level of pain. But the narratives on interviewing these patients was quite revealing. as you see here, the music was good for my pain. It eased my pain. Maybe it didn't lower my pain, but the music made me forget about the pain for a while. So again, we're looking at that focus of attention, just as those in labor were experiencing, that connection with the music, that focus that allowed them to put aside that pain for a bit. Another person, my pain levels themselves did not change much, but I did notice that the throbbing nature of my pain improved and became less noticeable during the music therapy sessions. Again, a qualitative difference here that we are seeing, and another that supports this idea of focus. The music therapy sessions help me focus away from my pain. And I might add into something very creative and expressive. So I have here from Melzak something that informs us about the nature of pain and pain management. And you see that there are many domains here that will determine how we perceive pain, and certainly how we feel it, how we perceive it, and how we can possibly manage it. So there are cognitive areas, there are sensory areas, there are emotional areas. Pain perception is a function of these. Involuntary and voluntary action patterns are a function. And we can see stress regulation also affecting the brain, and subsequently the way in which music can infuse the brain with thoughts, with sensations, with different emotions and mood regulation, as well as images, which literally may take you away from really focusing on that pain. So let me go now to the end of life with the third investigation that I'll share with you today. And that is with older adults who were experiencing depression and were diagnosed with mild or moderate depressive disorder. I did a randomized control trial with 3 different conditions. One was home visits. I was interested in reaching older adults who, for whatever reason, could not come into the clinic, and this was at Stanford Medical School and the Center for Psychotherapy and Aging. And these folks had been caring for someone at home and couldn't get out of the house to attend therapy. They were frail physically themselves. They were not able to afford the transportation, or were in a rural area and couldn't access the site. So this was probably one of the first telehealth experiments, certainly on music therapy, looking at a telephone-administered music therapy session compared with home visits. I made those home visits as the music therapist for 8 weeks and taught them music-based relaxation techniques. And we compared these 2 groups with a waitlist control group. The techniques involved body relaxation to music, moving to music, doing a progressive muscle relaxation to music, doing a facial massage to music. And once again, the music was selected by the participants. And the next set of activities involved mind relaxation, is what I call it. And it was based on imagery. Again, a nod to that very simple exercise I had you do at the beginning of our session today. Looking for music that would bring back wonderful memories, music that would infuse the brain with emotions, positive emotions. And this really was a cognitive behavioral psychoeducational technique, because I was teaching each person how to manage their depression by helping them relax, focus on the music, And through these various techniques, manage that depressed mood for sure. So in terms of mood, what you see here is the results with the profile of mood states shown pre, mid, post, and 9 months after the end of the intervention. And as you see, there are scores here that reflect going from low anxiety to high scores, which are more composed. So we're looking to improve mood from anxious to composed by having higher scores. The triangles are the waitlist control group. The dark circles are the telephone-based music therapy intervention, or as I also called it, self-administered, because they never met me. They had 2 pages of instructions. They selected their music, and they were asked to listen to that music daily. The home-based condition did improve more than the self-administered. But interestingly, 9 months after, while the group that had a home visit maintained that improvement in their mood, the group that were on their own, never having met me for a session, continued to increase and really improved to a significant degree. And if we look at depression scores, similarly, the control group, the triangles, maintain about the same level of depression. And the self-administered group with the telephone improved significantly, but continue that trajectory beyond the end of the intervention. And here's that home-based group that maintained, but not quite as well as the self-administered group. My theory was that in terms of locus of control, these older adults learned that they had something simple they could do to control and manage their depression. And these changes that you see post were significantly different when comparing the both music therapy groups to the control group. But what was very interesting is that the changes that you see here were clinically significant, such that at the beginning of the treatment period, they were scoring with significant depression being reported. But when they concluded the study, they more closely resembled a non-depressed sample of elders. So this was quite impressive in finding differences on all of the self-report measures we looked at: depression, distress with the brief symptom inventory. We looked at self-esteem and mood. All of these were significantly different between the 2 music groups and the controls. Clinically significant changes in the music groups, and as you saw, maintenance of gains even 9 months after the conclusion of the study. I'll just give you a nod in my last moment here of a current study right here at the Geriatric Psychiatry Division. And we looked at a similar music listening intervention with a telehealth strategy, meeting with a music therapist weekly. Folks were healthy older adults, but they endorsed loneliness during the pandemic. And they really developed connections with music. This woman sang, Pavarotti sang to me so beautifully tonight with Notte Piscator. Companion, perhaps a lover who stood with me, singing to me, hugging me, and protecting me. Life is so much better with a companion who sings so beautifully. even if he is singing to the entire world at the same time. He certainly transforms my world with such beauty. Now to sleep. Morning is fast approaching. So perhaps you see how music really does infuse the brain, enabling people to process what they're going through, but also focus on the beautiful in life, and music being a meaningful mechanism for change. So I thank you for listening, and I look forward to addressing your questions.
Thank you so much, Dr. Hanser. What an absolutely incredible breadth of work that you've been doing with people from various stages of life before they come into this world and at the very end of their life. I'm sure it's very meaningful, but you've also shown us how music can be so therapeutic and supportive through every different stage of one's life as well. So thank you for sharing a glimpse or a sliver of the incredible work that you've been doing. I'm sure that many audience members here have some questions. So those of you who'd like to unmute and share your question out loud to Dr. Hanser, you can let us know and we'll unmute you. And thank you. I already see some hands being raised, and others can also feel free to start to put questions into the chat, and we can start to look at them as well. So I see a Martina has her hand raised. So Martina, you can go ahead and unmute yourself and share your question.
Thank you so much. This has been amazing and incredible. I love every aspect of it. And also thank you for sharing your gifts with us to set the mood. So my question actually has to do with the educational criteria that one has to attain in order to become a music therapist. And I was wondering, in other non-US contexts, where individuals do not have those levels of training, yet still provide similar services, would we not consider that music therapy, what they're delivering, just because of the criteria that's set?
So it's obviously a challenge to know how well qualified a therapist is. And if they don't have a credential in music therapy because there isn't that training available in a particular region of the world, they probably have credentials as a psychotherapist, as an integrative therapist, maybe in other healing traditions. So we would give some credibility to those who have some credentials, and obviously, if they've had some music therapy training, that just gives us more confidence that they're able to develop the appropriate techniques for a particular clinical goal and objective.
Thank you, Dr. Hanser, and thank you, Martina, for your question. We also have Dr. Bala Subramaniam with a question.
Thank you, Suzanne. Thanks for this wonderful session, especially your introductory music. The main question to you is, along with this work, have you done some mechanisms explaining the mood changes because of music?
So that is not my specialty. My work has really been in clinical intervention. However, I am very happy to be part of a team at Northwestern University in the MIND lab, which stands for Music in Neural Dynamics. And Dr. Psyche Louie is investigating pathways in the brain that can help us account for the kinds of changes that we see clinically. So recently we published an article talking about how the reward pathways and the auditory pathways are very consonant, that they work together in consonance. And that was, of course, no surprise to those of us who feel that rewarding value of music. There's also some very interesting work with people who have Alzheimer's disease, because we see so many people for whom music, it's able to allow them to connect with the world and with reality, and people who have lost their contact with the world and are no longer communicating with others, hear a piece of music that was familiar to them, meaningful to them, and they are able to sing along every word. And it turns out that there seem to be areas of the brain where there are regions of interest for music processing that seem to be relatively spared in the brains of those who have a diagnosis of Alzheimer's disease. So there is some ongoing work that helps us explain what is happening under the hood, if you will. But there is so much that is spiritual. You know, the connection that this woman shared about her loving Pavarotti. You know, difficult to know what that really means. But to her, it meant everything. It helped her sleep, and it helped her feel connected during a pandemic when she was isolated from everything she knew and loved.
Thank you so much. And are you aware of any work in the area of, for example, kids? Not necessarily they should have ADHDs, but generally using music as a way for well-being.
Yes. Well, there's much in stress management, in pain management, as you saw in some of my work. I've not worked with children, but there is a lot of research in pediatric oncology and in pediatrics in general, ways in which music can help children engage actively and enjoy the experience in a hospital or during a medical procedure, when that connection with the music is helpful in focusing them on something other than the painful stimulus.
I'll just ask the last question and let others ask. This is about, one is people choose their own music, but there is also something that we need to prescribe to them based on what we know of certain music causing certain changes, which could be beneficial. So have you done that as well? How much is that field developed in terms of what kind of music is required for what kind of situations?
Right. This is a key question. What music, is appropriate and indicated? And I did one study a long time ago where I was attempting to look at the elements of music. And so I had slowly changing music. And I hooked people up just to blood pressure monitor and looking at heart rate at the time, and had them listen to this slowly changing music. One had more and more elements of the timbre of the music changing. It became from a simple tone to many different instruments in this simple melody. And then I had the melody getting faster and faster in another one. And in another, the opposite. The music got slower and slower. The elements, the timbre became much simpler over time. So it slowed down. The themes became looser, if you will. And there was absolutely no difference in the changes in blood pressure and heart rate when I played these two contrasting themes, which had the same musical notes, but differed in, obviously, tempo and timbre. And yet, when I asked the participants if they enjoyed the music and found it relaxing, there was a strong relationship between their perception of the music and the impact of it on their heart rate and blood pressure. So in other words, it was not the elements at all, but their preference for the music. And time again, we find that individual preference is the key factor in selecting music that will be able to have some connection and therefore be most therapeutic. Within that world of their preferred music, we then can look at music that tends to change mood, tends to change focus, tends to relax. And so we can categorize that music, but most indicated music that is their preference.
Thank you so much. I see other questions. I'll let Tulsi take over. Thank you.
You're very welcome.
Thank you so much for these lovely questions and for all of your answers, Dr. Hanser. We have another question in the chat from Kerry Hannigan, who says, thanks, this was very interesting. Curious how one can try something like this out outside of a research study.
Yeah, so music belongs to everyone. and to change our moods or to just help us pass the time, or if we're waiting in a doctor's office or in an anxiety-producing situation, you don't need to be board certified to be able to identify how the music makes you feel. And I recommend, in fact, creating what I call mood managing playlists. And the key is that, you know, in my experience as a music therapist, you can't really just whistle a happy tune and expect things to change, especially if you're really feeling a lot of distress. But what is indicated is matching the music to how you feel. This is called the ISO principle. Music therapists try to help people identify what is the music that says just how you're feeling right now, and play that music and allow those feelings to be processed. Allow that state to be explored a bit. And then think about your desired state. If you're really depressed, what would be really energetic music? If you're feeling very agitated and anxious, what would be very calming music for you? What's familiar to you? What's really associated with good times, positive relationships, wonderful events, concerts that have been attended? What's that music? And then slowly finding music that is in the middle, so that you start with the music that matches who you are, acknowledges those feelings. It's like an empathetic therapist there. The music matches those feelings. You are the best judge of what matches your feelings, so you can select that music. And then music that you really want to feel like, messages in that music that tell you just what you need to hear. And then something in between. And so you can create a playlist for anxious to relaxed, or sad to more content, or whatever mood changes you are experiencing. Yeah, so you can certainly experiment with music on your own, and you can even create playlists for others that have, well, songs with really upbeat messages and affirmations, music that you find either relaxing or exciting or just novel and interesting. And the gift of music to someone else is something that's quite significant and meaningful, I think. So I hope I've answered your question, Tilak. Oh, that's not Tilak. Oh, why are musicians more prone to anxiety and depression? Yes, well, I really don't know the answer to that, and there are many theories. And I know in the U.S., musicians are not valued very much. They're not paid very well. The conditions of working are very stressful. It's not like baseball where you have 3 strikes. You know, a single note that's out of tune can be devastating. And so it's a hard life for musicians and artists. And they are constantly under scrutiny from an audience. And it's difficult to know what is going to please your audience, what is going to sell records. So it's just not a surprise to me that musicians would have more anxiety and depression than others in the general population.
Thank you.
Thank you, Dr. Hanser. It is kind of disheartening to hear that, and maybe there needs to be a little bit more of a push in terms of resources and support, across the board, nationally and internationally, for those who carry this gift and bring it to others, right? I see also in the chat, there's a link shared by Karina, who is sharing the WHO recommendations for arts and health. Do you have any comments to make about that, and or any other resources that you want to sort of leave us with as at the end of this talk?
Love to. Thank you, Karina. Yes. So there's a recognition now that music really can be therapeutic, but it must be used appropriately and in the right hands. And many people are wanting to volunteer in hospitals. There is much volunteerism in hospices, palliative care, and the music needs to be really selected most carefully, because music that happens to have an association with a traumatic experience, or even just a time in your life when you were very distressed, could be contraindicated. So, there are now more organizations that are interested in developing clinical guidelines, and there are books available that offer some assistance in how you can either work with a music therapist to design your, if you're going in to entertain, to design the program, or tips from music therapists, well, like the one I threw in today about the ISO principle, matching the mood. That could be very helpful, rather than, again, going into the room of someone who is critically ill and playing very happy, joyous music that may just, again, be contraindicated. So, thank you, Karina. I also am president, as you so kindly mentioned, Tulsi, the president of the International Association for Music and Medicine. And we are also very interested in forming a community of musicians and physicians and people in healthcare and mental health care, and people who are music practitioners, and people who have an interest in using their music for health and well-being. So you will probably see many more guidelines and encouragement to use music and the arts in healthcare. And I see some new trends about music therapists. Yes. So I think that health and well-being, especially post-pandemic, is a key issue for everyone. And music therapy is not just for people who have a diagnosis or a clinically significant condition. Music is for all of us. And there are ways that we can communicate and express ourselves, and there are opportunities to make music together in a setting that isn't with the performer on stage and all of us sitting politely and only applauding at the end. So again, there is much to be learned, much to be experienced, and I really do appreciate this opportunity to share some of my life as a music therapist.
Thank you, Dr. Hanser. I see we have one last question from Hari Prasad Hegde, who asks, any research on how listening to chants would heal a person?
Yes, I can't speak off the top of my head. Feel free to email me, and I'm at Berklee, shanser@berklee.edu. There is a growing body of research compared with silent meditation, chanting, use of breathing techniques versus singing. All of these things are now being researched, and there's more and more data to support all of these uses, depending on the needs of the person.
Thank you so very much, Dr. Hanser. It's been such a pleasure and delight to not only hear you speak about the music, but actually hear you play some of your music for us today, and to learn about the various resources that one can access and also build for themselves at all different stages in life through illness and wellness. So really appreciate your support with these resources. And if you don't mind, we can share your email in the chat for those who have more questions and would like to reach out to you.
And I'm also putting in the chat, I am online, which is the International Association for Music and Medicine. And we have an international conference coming up in Berlin a year from September. So perhaps I can meet many of you there.
That's very exciting. Wonderful news. So thank you for these lovely resources that you're sharing in the chat. And, those of you who are joining us for the first time today and hope to join us for future events, we'll just be sharing a few resources for you as well. Nasha, if you don't mind sharing the slides, please. We have some exciting events coming up. So if you enjoyed today's talk, we have another wonderful speaker joining us next month for our continuation of our monthly speaker series, where we'll be looking at the impacts of being aware of positive emotions on reducing risk for suicidal behavior in youth. So Dr. Shirley Yen, who's actually one of the members of our scientific advisory board at our center, has been doing some incredible work, and her research on reducing suicide risk in youth through various types of programming, including mindfulness programs, is really interesting and really inspiring. So we hope that you will all join us next month to learn more about this area of research from Dr. Yen herself. Dr. Yen is also a professor of psychology at an associate professor of psychology at Harvard Medical School in the Department of Psychiatry, and also works with the Massachusetts Mental Health Center. So it'll be a delight to hear from her next month. Next slide, please. And in addition to these amazing programs we learned about today, our center also offers yoga and meditation programs curated for various members of our medical community, including those with long COVID. We've curated a set of breathing techniques and meditation programs to support those living with this disease. We also support our hospital's cancer survivors and support them with their quality of life through various wellness techniques as well. In addition, we have an ongoing program to support the mental health of those living with Parkinson's disease. And we also offer resources to the larger community, including healthcare providers who are also, dealing with burnout, anxiety, all sorts of mental health challenges themselves, and the general public with our personal wellness programs right here in Brookline, as well as online. And you can always reach us to learn more about any of these programs. We also have more information about these programs on our website. Next slide, please. To stay in touch about all of our upcoming events, including our speaker series, like the one you've attended today, as well as some more exciting events that we'll be sharing about shortly, please make sure to subscribe to our newsletter. Then you'll be amongst the first to know about any exciting research findings that we publish, any highlights from our center, upcoming events, and we like to feature various members of our community as well. So you can learn more about what's going on in the field. Next, please. And I am beyond excited to invite all of you to join us for our very first conference on consciousness right here at the Harvard Medical School, which will be happening on October 26th and 27th this year. And our theme for this year is consciousness, science, spirituality, and social impact. So many of the connections with the talks, explorations today as well. Joining us along with many global thought leaders from across various disciplines, from the medical sciences to the neurosciences to business and leadership to environmental consciousness, is Sadhguru himself. And we will be so excited to have him talk as our keynote address with Steven Pinker, renowned cognitive psychologist, at the Harvard Sanders Theater. And so please, this is something that you should not miss out on, and there are limited seats available. So we urge you to register as soon as possible to secure your seat for this conference this fall. Next slide, please. And finally, please stay in touch with us on social media. This is another way to stay connected, to continue the conversations that we started today and that have been ongoing from previous events as well, and to be the first to know about all upcoming announcements and future programs. And lastly, you can reach us anytime via email at sadhgurucenter@bidmc.harvard.edu if you have any interest in collaborating with us on research studies, or sharing any resources, or learning more about any of the work that we do or any of the speakers that we host. You can always contact us via email, and we'd be happy to support you as best we can. The email and the information for our center is also in the chat, so you can click the link there. And thank you all so much for taking the time to join us for this very enlightening and inspiring conversation today with Dr. Hanser. And we hope to see you at our future events and sometime in person in Boston as well. And thank you lastly, Dr. Hanser, again, for your time and efforts and the work that you do.
Thank you very much, Suzanne and Tulsi. Thank you.